The maxillary artery is a branch of the external carotid artery and supplies many structures on the face. The maxillary artery divides into three segments relative to the lateral pterygoid muscle. The first two divisions are within the infratemporal fossa, whilst the third division is within the PT ergopalatine fossa. The first division, also known as the mandibular division, lies posterior to the lateral pterygoid muscle. This part has 5 branches: the deep auricular artery and anterior tympanic artery, which enters the squamotympanic fissure. The middle meningeal artery that runs between the tensor veli palatine muscle and lateral pterygoid muscle to enter the foramen spinosum into the middle cranial cavity. The accessory meningeal artery that enters the foramen ovale. Lastly, the inferior alveolar artery that enters the mandibular foramen and gives rise to the mylohyoid artery and mental artery. The pterygoid division or second division runs lateral to the lateral pterygoid and supplies the surrounding structures. This segment of the maxillary artery gives out the anterior, middle and posterior deep temporal arteries, buccal artery, masseteric artery, and pterygoid branches. Finally, the PT ergopalatine or third division consists of all the terminal branches and runs anterior to the lateral pterygoid muscle. This division of the maxillary artery provides the pharyngeal artery that enters the palatovaginal canal, the greater palatine artery that enters the greater palatine foramen and gives rise to the lesser palatine branch, the artery of the pterygoid canal, the sphenopalatine artery that enters the sphenopalatine foramen, giving rise to the posterior lateral nasal arteries and posterior septal branches, the posterior superior alveolar artery, and lastly the infraorbital artery that enters inferior orbital fissure and gives rise to the anterior superior alveolar artery. Thank you for listening and see you next time.